we will see the some collateral ligaments of the knee joint. First one, oblique popliteal ligament. It is an expansion. This is the oblique popliteal ligament. This is the posterior aspect of the knee, and what you are seeing here is the oblique popliteal ligament. It is an expansion derived from the insertion of semimembranosus. This is the semimembranosus insertion. So it looks as like an expansion from it, and extends for upward and laterally from the posterior surface of the medial condyle of tibia to the lateral intercondylar line of the femur. It blends with the posterior part of the fibrous capsule, forms the floor of the popliteal fossa, and this ligament is pierced by the middle genicular vessels and nerves, and also by the genicular branch of the posterior division of the obturator nerve. Next ligament is the arcuate ligament. Arcuate ligament, here lies the arcuate ligament on the lateral aspect, lateral and inferior aspect. Arcuate ligament. It has an anterior band, a posterior band, and have a Y-shaped arrangement. The stem is, this is the stem. It is fixed to the styloid process of the head of the fibula. The posterior band arches over the tendon of the popliteus, and it is attached to the lateral condyle of the tibia. The anterior band, often deficient, passes deep to the fibular collateral ligament. This is the fibular collateral ligament. So the anterior band passes deep to the fibular collateral ligament and is attached to the lateral condyle of the femur. Here it was attached to the tibia, posterior band attached to the tibia, anterior band attached to the lateral condyle of femur. Next, we are going to see the coronary ligaments. Here it is. Here, the coronary ligaments, they are parts of the fibrous capsule itself, which provide attachment to the peripheral margin of medial and lateral menisci. In this diagram, only the medial coronary ligament only shown. This is the medial meniscus. Next one is the transverse ligament. Here it is. This is the anterior aspect. So this is the transverse ligament. It extends transversely and connects the anterior horn of the medial meniscus to the anterior margin of the lateral meniscus. Next one is the menisco-femoral ligament. Menisco-femoral ligament, it also has two parts, an anterior portion which is over here, a posterior portion which is shown in this region. So the menisco-femoral ligament is the structure which attaches the posterior horn. This is the posterior horn of the lateral meniscus. So this ligament attaches the posterior horn of the lateral meniscus to the medial condyle of femur. It has an anterior and posterior divisions. The anterior ligament, also known as ligament of Humphrey, passes in front of the posterior cruciate ligament. This is the cut portion of the posterior cruciate ligament. So the anterior ligament passes, anterior menisco-femoral ligament passes in front of the posterior cruciate ligament, and the posterior ligament, that is known as ligament of Risberg, that passes behind the posterior cruciate ligament. Menisco-femoral ligament regulates the forward movement of the lateral meniscus during extension of the knee.